Good afternoon. Good afternoon, everyone. It's 12:30 on Wednesday, October 25th, 2023, and I hope everyone is having a fabulous day. It's a Dialysis Patient Citizens Educational Center, and I am Dr. Scanterbury coming to you live at this Facebook Live so we can have a conversation about anything that concerns you regarding dialysis or transplantation. So I invite you to send a message out to your friends, allow them to know they can come on and we can have a discussion about what's going on. We're now in the fall. It's a beautiful fall day. If you like fall temperatures, it's really a time to get out and enjoy the season of colors, as well as to get some of that fresh air. It's good for the lungs and also for your ventilation, and oftentimes can, for some people, unfortunately, it may aggravate their allergies and their sinuses. So you want to be careful if you're going out for hiking or walk to make sure you take your antihistamines or your medication, your allergy medication, so that you are not encumbered by all the stuff that's blowing in the air. But generally, it's refreshing to be able to get out there. So again, I say I'm Dr. Scanterbury. I am medical consultant for the educational program here at DPC, and I'm here to answer any questions you may have regarding issues of dialysis or transplantation, getting on the list, seeking a living donor, having trouble with finding or being on the list too long and nobody has called you. What's going on? How come I haven't gotten a call? What is that all about? And it's important to also remember that you can be sure to go to the website, dpcedcenter.org, and there's a vast amount of information there that you can learn about treatment options, staying healthy. As you know, we are tasked with how do we stay up with our health, whether it's getting all our vaccinations, whether it's getting our cancer screenings while you're on dialysis, or whether you have a kidney transplant. It's still important to stay up to date with your health and your overall medical well-being. So you should all have a primary physician who is keeping check of all the different consultants you're seeing. Some of you are seeing a cardiologist, and some of you are seeing pulmonologist. You want to make sure you get all your healthy checks done, and someone is coordinating all those different results and really relaying to you what's going on with your body. So we know that this is now towards the end of October. The CDC has put out the new monovalent vaccine, and if you are on the list, whether you've had a transplant, unfortunately, if it's only been a month, usually they want you to wait to get any vaccinations. But this is totally different from any previous vaccines. And remember that the virus mutates and changes. So even though you may have had 5 or 6 or other number of boosters in the original vaccination back in 2021 or 2022, remember this is a different virus now. It's changed. And so the composition of the antibodies that need to protect you from the new virus also changes. So this vaccine is not equivalent to the one you got 6 months ago or a year ago, because a different virus, the same virus, but different composition in terms of having mutated to what's causing the attack. So you have to get an updated vaccination. Remember that your antibodies for vaccination wean or disappear over time, which is why every year we need to get a new flu vaccine, because number one, the virus changes and there may be a different strain of the virus around from one year to the other. So your vaccine from last year isn't going to do you any good this year. And so the same thing with COVID. There's different strains of the virus. So therefore we need, as it mutates, when it attacks one person than another person, it changes, and so it becomes more virulent, a whole different attack mechanism. And so this is the reason why you need to get updated, because as someone, whether it's transplant or on dialysis, you are immunocompromised, and so we want to stay healthy. So can a person who has cancer get a transplant. And yes and no, when you're coming in to be evaluated for a transplant, we want to make sure that you do not have any cancer at that time. There's some people who have been diagnosed with cancer or had it in the past, and when you come to transplant, you want to be able to be free of cancer. So some patients, if they're newly diagnosed, and it may be a simple cancer, it may only require a year of waiting time. If it's dependent on the size of the tumor and the prognosis of the tumor, you may require treatment, surgery, chemotherapy, radiation. And once your oncologist says that you are free of detectable cancer and okay to undergo a transplant, then you are then activated on the transplant list. So some people will stay on the list while they complete the treatment and allow them to accumulate time, but inactively, until they're ready to be transplanted. And we want to make sure you're free of cancer, because one of the things that happen is that your cancer in your body is stimulated by having a poor immune system, in that your body cannot fight off the cancer. Therefore, when you get transplanted, we are wiping out your immune system, and therefore we are worried about whether or not that cancer is going to come back. So for patients, we want to really make sure that they're not at risk for recurrent cancer. And so we will oftentimes have to alter some of the anti-rejection medicine and keep an eye on that surveillance. So that becomes crucial in doing that. There's some patients who unfortunately will develop cancer after they have a transplant, and we will go ahead and treat them for the cancer, but oftentimes it means backing off on their immunosuppressive therapy to allow the body a chance to fight that cancer, because they're not going to necessarily die because of kidney disease, but they may have more problems and complications from having that cancer progress while they're trying to hold on to the kidney. So those are issues that we have to deal with, and it's important for you to maintain your cancer surveillance, and for us as transplant surgeons to really make sure that we are doing our due diligence in keeping you free of cancer. And so some patients do not like the fact that they may have to wait, but it's really about making sure you can survive and do your best with that transplant that occurs. Someone said after C-section, both kidneys failed and size became small. Biopsy report, only 20 nephrons. Is any chance of recovery? And so one of the things that happens with kidneys, depending on how long that kidney was in place, is that yes, your body, I say kidneys are like getting a car. You can get a new car or a used car, and both may work just as well. But you need to monitor that car, just as you need to make sure that you tune it up and that you do as much as you can do with with routine checks. And so the same thing with kidneys. We have to make sure we do all the surveillance mechanisms, but as with anything else, you're going to have wear and tear on that kidney. And because it's not 100% you, and your body is constantly fighting that kidney to get rid of it. And oftentimes, just like your car or your house, some things fall apart. And it's often, the question is it repairable, or it has to be replaced? And with development of more and more scar tissue over time, oftentimes this may not be salvageable, and it all depends. I'm not sure, only 20 nephrons, depends on the size of the biopsy that was done, what overall percentage of scarring in there is there. And so some patients may require getting relisted for another kidney, or even sometimes changing the medications to get rid of those medications that may be may cause your creatinine to be higher, to give your kidney a chance for prolonged survival while you wait for that to be for a replacement kidney by getting relisted. And many people can get relisted even though they may not be ready to receive a kidney. So you may realize that once your kidney is starting to fail, it's better to get relisted as soon as possible, because you're accumulating time again. The time from your first transplant isn't going to matter if you've had that transplant for more than a year. You have to start over again. And so while you may not be quite at 20%, or you may be 19% or 20% to get listed for that transplant, you may be in good shape enough to say, well, I can wait until I get that perfect kidney or until I'm really ready to get on the list. So is there a chance of recovery? It all depends on, what's the overall kidney function for that kidney, and how much scarring is there, and whether there can be a change in some of the medications to allow for improvement in or stabilization of that kidney function over time, making sure that you control your blood pressure, fluid accumulation, and all the other factors that are controlled by the kidney are being monitored and adjusted to give you the optimal outcome. So thank you very much for that question. It's a little bit more complicated than probably I've allowed for answering, but I hope that gives an idea of what to do, what is happening once your kidney is starting to deteriorate, or whether you have a lot of scar tissue in that kidney. And remember, unless that kidney is from an identical twin, your body is always going to be on the defensive to get rid of that kidney. Some people have a strong immune system and they may lose their kidney early, and other people, the patients have developed a harmony with this kidney that is not them and live in harmony for many, many years without an issue. And that all depends on your body's ability to use that immunosuppression to keep that kidney at bay, so that you are not losing you're not having constant attacks, which may be not noticeable. Your creatinine may not change, but over time, every kidney will develop more and more scar tissue. The rate at which that occurs varies from patient to patient. So thank you. Another question from Ian: how do you feel about using medical cannabis? Well, I'm going to stay away from that one, because some things can alter the availability of your immunosuppressive drugs. So it all depends on the form of which you use that cannabis. I tell patients, the issue with smoking is that you have issues with inhalation, and a lot of the stuff may be contaminated with fungus, and we've seen a lot of underlying pneumonias with abnormal infections in patients who were smoking marijuana, because oftentimes the leaves are not as clean and they end up with fungus infections. And so we are very cautious about what we tell our patients. My best recommendation to you is to discuss it with your doctor, why you need to have that medical cannabis, how are you using it, and does it put you at risk for alterations in your immunosuppression, and meaning those drugs that you're taking to prevent rejection. And some medications will decrease the availability of that medication once it's in your body. And we want to make sure you discuss this with your transplant pharmacist so that they are able to assess your drug levels if indeed you really need to take this medication. So that's a discussion for you and your team, and thank you for asking that question. Let's see. Hi, Josh. Hi, Carrie. Any information about, I can't read that. Faritska will be helpful. Please guide me and answer on comment messenger. I'm worried. I'm not sure about what. But I wanted to say thank you to all those who are joining. And Yolanda is telling folks, all of those who want to call, to go ahead and go to DPC Dialysis so you can become members. And certainly you want to learn more about what this website offers and these conversations. We even have, besides Facebook Lives, we have Instagram Live, we have chats that occur every week. And so those are things that you can log on to learn more and more information. There's a lot of questions about is Ozempic another medication for weight loss safe for transplant patients? All depends on on what your underlying creatinine. Some of the weight loss medications are not affected by kidney function. And so it's important to realize that there are also others that are affected by your underlying kidney function. So even though you had a transplant, it's hard for me to say whether it's safe for you or not, because each transplanted patient will have different estimated GFR. It depends on where your overall kidney function lies and whether that drug is cleared by your kidney or not. So that's a discussion, not just because you have a kidney. If your kidney function is normal, then there is usually not an issue with using some drugs. But if you have abnormal kidney function despite having a kidney transplant, some medicines will need to be adjusted. So don't base your regimen on what I say here, but have a real thorough discussion with your transplant nephrologist or your transplant pharmacist, as well as those medications that may affect whether or not your kidney is able to metabolize them or not. So it's important for us not to really discuss medications in a situation where everybody is different. Their response to those medications is different from person to person. So depending on not only just your kidneys, what's your underlying liver function? Do you have underlying heart disease? And so those things are really not things that I could tell you whether to take it or not take it. What's the worst thing a person can do purposely to their kidneys? Depending on whether you're already on dialysis or whether you're a kidney transplant. Purposely, if you had a transplant, what's the worst thing you can do is stop taking your medication, skipping your medication, realizing that somebody or some family gifted you with that gift of life. And so out of respect and out of the paying tribute to that donor family, the best you can do is to take care of that gift. It's a gift of life. It's a gift of love. So the worst thing you can do is to negate the gift that's given to you and throw it out the window by not taking your transplant medication when somebody else desperately could have had that kidney that could have saved somebody else from bad outcome or to save somebody else from dying. So you now have taken something and destroyed it when someone else could have benefited from that. So I would probably say that's probably the worst thing you can do purposely, because you have control over whether or not you can take that medication. And the same thing with if you have children who have had transplants, and as parents, we want the best outcome for our kids. And so as parents, we are responsible for making sure those children, those minors, take their medication. And so we have that responsibility, not just for ourselves, but for those who are under our care, or whether it's you're elderly or whether it's someone who is not able to take their medications on their own. So destroying a kidney that otherwise could have helped someone else is something you don't really want to do, unless you do not really appreciate the fact that a lot has gone into that donor family who is now thinking that they were able to help somebody else, and that they're wondering how that person is doing, and they're taking care of their loved one's organs that they sacrificed and donated. And just imagine, I know for many donor families, not even hearing from the recipients is they wonder what's going on with them, why they haven't responded. So if you haven't written to your donor family, please, on another topic, and you've had a transplant, go ahead and do so. It can be done anonymously, and it's up to the donor family to respond. And there are also donor families who don't want to know what's going on, but that's their choice. But I think if you receive the kidney just out of gratitude, you can send that letter thanking them, send a card, and they oftentimes may not respond, but they appreciate, when I talk to them, they really appreciate getting that card. They just can't seem to bring themselves to connect, and others do. So there are so many various situations when it comes to that. Without knowing, of course, besides Pepsi, diabetes, I'm not sure what the question is, but certainly you want to avoid drinking things that are bad for you. I know for those of you who are on dialysis, you want to avoid colas because they're high in in phosphate and they push your phosphorus up. And so whether it's one different to another, if as long as it's a cola and it's dark in color, it will make your phosphorus high. And phosphorus is one of those factors that is not dialyzed out, and so you have to take binders to get rid of it. And unfortunately, if you're not compliant with your binders, you're going to have calcium, phosphorus metabolism problems, and you end up with more deposition of these products in your blood vessels, leading into atherosclerosis and thickening and hardening of your arteries, which becomes a problem that makes it very difficult for patients to get transplanted because now their blood vessels are very hard. And it's obviously when you do a CT scan or even an X-ray, you can see the calcium phosphorus buildup in your arteries and leading to peripheral vascular disease, leading to impotence, leading to heart disease, leading to stroke. And so all those things become consequences of not following the regimens that is recommended by your dialysis med. So stay away from any colas. Besides, we also want to realize that sodas in general are high in sugar. And as someone was pointing out, if you're diabetic, you also want to control your blood sugar. You don't want to feel like you're not diabetic because you're on dialysis. And remember, many people, when they start dialysis, your kidney function deteriorate. You don't have kidney function anymore. And so your insulin, the metabolites of insulin are not able to be excreted because they are excreted via the urine. And so what happens is that the insulin that you were taking, supplements, are no longer needed in great quantity. And even from some patients, the small amount of insulin they're taking that their bodies are making is enough to control their blood sugars, and they feel they're not diabetic anymore. But once you get transplanted and your kidney function is restored with a new transplant, you're now able to urinate and excrete the metabolites of the insulin that your body makes, and so it's not around in your system as long. And so immediately in the post-op period, we have to restart patients on their diabetic medications. And now they're quite surprised that, how come I wasn't diabetic? Well, you were diabetic. It's just that while on dialysis and not making urine, you're unable to excrete the byproducts of insulin, and so they hang around your body longer to be reutilized. And now when you're urinating, now you need to have those supplements restored because the metabolites are passed out. And so even after transplant, as a diabetic, we still have to work on controlling your blood sugars. We still have to make sure that diabetes doesn't affect the new transplant. So it becomes important to be definitely in compliant with keeping your hemoglobin A1C under check, keeping your blood pressure under check, and as well as your cholesterol, because we know that all three of these contribute to underlying heart disease. And even after transplant, we want to make sure that you get the longest survival time with that kidney. And we don't want to complicate your course by, unfortunately, having you develop worsening heart disease from worsening diabetes, or develop peripheral vascular disease, get a heart attack because your numbers are out of control. So even though you get a transplant, it's still also about staying healthy. It's about staying up to date on all your medical exams. If you have underlying heart disease before your transplant, it's important to continue to see your cardiologist after your transplant to make sure that you get those interval screenings of your heart, whether it's an echo or stress test, as well as any other alterations in your medications or adjustments in your medications now that you're off dialysis, and some of those medications may be preferred with now that you're off dialysis and have a functioning kidney transplant. So it's all about quality of life and really being able to get you back to a state of health that you can enjoy by not being on dialysis. And now your body is really being able to get rid of all those metabolites with a new kidney. It can excrete all those things that are built up in your skin. And you know that for many patients, the skin color changes when you're on dialysis. It gets darker and darker, or more grayish colored and dull, due to phosphorus buildup. And then suddenly after transplant, you see that all those metabolites being able to be excreted in your urine. And for many patients, they see that their color will change somewhat, and it becomes a little bit more vibrant from excretion, and particularly of all the phosphorus and different metabolites, the urea is built up in your system. So your BUN comes down, your color changes, and so it's very, very heartening to see and encouraging to see that there are patients who feel better, look better, and now are able to get out and do more. Why you guys, kidney doctors don't want patients drinking Pepsi. If you're pre-transplant, if you're on dialysis, it's high in phosphorus. It adds to more phosphorus load, which means you need to take your binders. It can lead to worsening atherosclerosis because it's not excreted in the dialysis. And sodas in general, not good for anyone. And so I don't encourage people drinking sodas. Whether it's the caffeine you need or whether it's the sugar, it's really important to know that certain things affect your body, and whether you're on dialysis or not on dialysis, it's usually not good. And number two, it also has to do with your fluid intake. Why use something that's going to, if you're not making urine, can throw your fluid volume off balance, worsen your phosphorus, and lead to high phosphorus levels, which lead to a worsening vascular disease. So find something as an alternative to drink that's beneficial to your system overall. As someone said, discipline is so important while on dialysis, and so it's important to control your fluid intake. Remember, this all affects your heart. Your heart is the most important system that's going to regulate the rest of your body. And if your heart is overloaded with too much fluid, it's not going to work well. And if your heart fails, everything else will not be able to function properly, because now it's not going to pump that needed oxygenated blood to the rest of your organs. So your brain gets affected when your heart's not working well. Everything else suffers as a result of a poor functioning heart. And when your fluid volumes are constantly out of whack on dialysis, gaining more than you should, it's going to weaken your heart. And so you find that your heart acts like a balloon. Now it's dilated with more volume, you squeeze it off, and so you lose the elasticity of your heart the longer you are on dialysis and the more non-compliant you are, especially with hemodialysis. So stick to your regimen. Make sure you control your fluid volumes, because that's your lifeline, and you don't want to damage that. I thank you all for all your wonderful questions. It's been a great 30 minutes here on Facebook Live with DPC. And I hope to, for many of you, tell your friends. I'll be on Instagram Live next week, because I was away a week ago when I normally have this Facebook Live. But I want to say thank you for being here, and continue to keep well. Look after yourself, look after your family, take care, enjoy the weather, and be well. And I'll see you next time. Take care.